We'll start with the basics. If you say and spell your name.
Yep, my name is Jennifer Riley, JenniferRiley.
And where do you work and what is your job title?
I work at Memorial Regional Health in Craig, Colorado, and I'm the Chief Operating Officer.
I'm going to ask you, we're going to get into, what your average day was like pre-pandemic and then now, but I was wondering if you could give me just some information about your COVID in your community.
So we've been pretty fortunate in Craig. We've only had a handful of positive cases. Originally, we were just reporting 7 cases, but some of those cases after we had done the contact tracing have been assigned to other communities. So I think in our community, we've only had 4 positives. So from that perspective, it's been very minimal. Now our community has followed all of the governor's orders. As a hospital, we have put in very strict and stringent processes and policies to minimize any exposure, but we don't have a lot of it here in Moffat County or Craig.
That's good. Mm-hmm. Tell me what you do as the Chief Operating Officer on the average day, and then how that's changed due to COVID.
So as COO, I oversee most of the operations of the organization. I focus a lot on we have outpatient medical clinics. So we have, 4 locations. We employ about 24 providers from primary care, general surgery, pediatrics, dermatology, cardiology. So we have a broad array of services that we offer. I also handle all the marketing communications that comes out of my world, my department. And physician staffing is my area too. And right now I'm also handling all the med staff credentialing because we have our credentialing. We've had a big gap for about a year. So I've been doing that. And so in addition to all of that, I now am the public information officer for the county's incident management team to help communicate what's going on with COVID in our community. So I work with it's a multidisciplinary team that's got our Office of Emergency Management, Public Health, all the law enforcement people. So I'm on that. And then I'm also from our facility, I do all the communication around COVID for the staff as well. So same jobs plus jobs.
Yeah. What would you say has been the most difficult adjustment to your work life due to COVID? Is it the addition of all of these extra responsibilities? Is it the way you have to do your job?
Well, fortunately or unfortunately, I still came into work every single day. I'm home this week for personal reasons, but we didn't stop coming to work. So I didn't have to figure out telecommuting or anything like that. It has been a bit of an adjustment for some of our departments that aren't on site, where they're staggering people. We maybe don't have access to some of this personnel that we need if we need them quickly. So that's been hard. It's been hard too with some of the, tightening down visitor restrictions, tightening down access to the building. It's been hard to see some families going through difficult times and not, having to really limit who is there. We don't see people in the building like we used to. We closed down our cafeteria with the exception of just, serving meals to our employees. So we don't have public interaction. So from that standpoint, it's been figuring out kind of the new way of doing business and adapting to that.
Can you talk to how your communities come together? You said that you are the communications officer for this new group, the coalition, I assume. Can you talk about how that came about and what you've been working on?
So some counties opened up their emergency operations center, and we just did not feel like we had the need to go like a full full on EOC. We definitely engaged all of the stakeholders that were potentially impacted by COVID and what was happening. So, but we don't, it's not a formal emergency operations center. So it was formed by our Office of Emergency Management and the emergency manager, and he functions out of the sheriff's office. And then they pulled in the hospital, the police department, communications dispatch, public health. Let's see, who else is at the table? City council is there. Our county commissioners are there. So we have voices from all, really all the key players in the community. And really it was easy to do. We said, this is the need, and here's who we think needs to be at the table. And nobody had a problem with stepping up. I just volunteered to be the PIO. I have that experience, and we just needed someone to be able to do it. And I was able to just do that. So
what's the response been from your community?
Really the community's, for the most part, I think they've been super supportive of like the hospital. I mean, more people have come, to us and said, oh, we want to buy you lunch, or we want to, they've been just really supportive, which has been awesome. Especially because we haven't, as a community, been hit really hard with lots of illness, thank God, but they've been great. And I think for the most part, our community has been compliant to a degree with what the governor's asking. Western Moffat County, like we're the very western part of the state. There's a very big group here that feels like we're going to do what we want to do, and so there's been a fair amount of compliance, but they're getting antsy, and I think our county's already they're asking for waivers from the state, so we'll see. I'm a little nervous about what this looks like for the future.
Here in Mesa County, we applied for a waiver and we got it. A few weeks ago, I was headed out on a hike, and I chose to drive down North Avenue, and there was cars galore protesting the governor's orders. You go into places and half of the people aren't wearing masks, and it's hard to get people from, walking right up to you.
Yeah.
So,
and you guys are in a way worse position than we are, because, well, my husband's friend was driving back home. He'd been down in Santa Fe, and he came up through Fruita, and he said it was like monkeys out of the zoo. He said it was the mountain bikers, the trailheads were crowded. There was nobody practicing social distancing. And I mean, obviously Fruita is a huge draw for a lot of people. And if Mesa County opens up, which they have, and the Front Range is closed, it's going to be a problem for Mesa County.
Yeah, people are going to want to come here.
Absolutely. And that's what's going to happen here too. We've got a lot of, we have a lot of public land. 2/3 of the county is public. And it makes me very nervous. I'm more worried today about outbreak, what the spread, than I was a month ago when we locked everything down. So,
how is this event affecting healthcare disparities or social determinants of health in your community?
Well, the social determinants of health, that's a really interesting question. And I think certainly the access to medical care hasn't changed a whole lot. We're still able to provide critical services. We're still able to provide services. We never stopped providing medical care, emergent or non-emergent.
Okay.
But what I think the biggest disparity is coming with education, and what with the schools having to be closed. Any kid that is on, that has an IEP or has, a special need with respect to education, there's no way the schools are meeting those kids' needs. And that's just furthering, the disparity between those kids and their peers. And I don't know how our system is going to overcome that. I saw, or my husband was telling me about a study he saw, a survey one of the news channels did about, what is it you need for your kids in education? And most of it is that social connection. They need that social and emotional support. And that's what schools provide to kids. And I think is where the biggest disparities are coming. There's a lot more isolation now because of the stay-at-home orders, because of the restrictions. And, like I said, at hospital, we're not seeing people. There are people that don't have those connections to other human beings that I think are lacking. I think it's been very hard for our elderly population too, the isolation and not having the connections. And I think that's where we're probably going to see it the most, because there's not a really good way to overcome that. There are some food disparities. We have a soup kitchen. It's all volunteer, and they were providing 2 meals a week prior to COVID. Now they provide a third meal, because we have a huge, relative to what I know, we have about 150-ish people who are considered shut-ins. They don't leave their homes and we take them food. So that's having an impact. Those are some of the disparities I think are really difficult to overcome.
Have you guys been able to do any telehealth with your clinics?
Yeah, so we didn't really have a good platform for telehealth before this happened. It just, connectivity here is challenging. So we just hadn't gone down that road, and then we immediately had to figure out a way to go down that road. And so we did launch the ability to receive care via Skype. We were using Skype as a platform because that was allowed under the Medicare 1135 waiver. And we had some people take advantage of that. But we did find a good way to it's sort of a hybrid telemedicine. We have tablets that communicate with each other in the same Wi-Fi system. And so we could get patients physically in the building. We could have minimal contact with them, do a lot of the communicating via tablet with them. And then if you did have to go in and do a swab or go in and do any sort of physical assessment, it really minimized how long you were in a room with someone. Because one of the pieces that our physicians were looking at was the information about viral load, talking about, some of the cases of COVID have been more mild in people who aren't exposed to it all day for 12 hours a day. And so that was something that has been successful. So still able to come in, get something done, but minimize that one-on-one contact. So we're doing it. It's not been a huge, it hasn't really been widely adopted, I wouldn't say, but we're able to do it.
In an area where you don't have a great cell service, I would imagine it would be hard, or great internet. You don't have high-speed internet in Craig, do you?
We do have high-speed internet in Craig proper. We're getting broadband. It'll be available soon. But out in the county, if you live out 10 miles outside of town, then you're more reliant on the satellite. So it's not great. It isn't.
How is this going to alter how care is given in the future?
Well, I think we've implemented some practices today that will probably continue if we can. And one of the practices, obviously we've always we've paid attention to infection control for sure. That's never not been important, but I think the way we're doing it today is a little bit more heightened. We are separating sick visits and well visits in our medical clinics. And so in the morning we have all the well patients, and then we have a gap between them, and then we have the sick patients at the end of the day. So then we can do more terminal clean between the sick patients and the next day when the well patients come back. I do think we will probably continue to see some visitor restrictions in place. Flu season, and I am certainly not comparing COVID to flu. It's a virus, it's contagious, not nearly as contagious as COVID, but we didn't lock down the building when we had an influenza patient, right? But maybe we should have, or, we definitely, I will say this, we've had far more staff out with flu, where they've gotten sick from patients that they're seeing or coworkers that they're seeing than we did. I mean, well, luckily we had very little positive, but we haven't had that residual sickness. So I think that says a lot about, I think we could maybe beef up what we're doing year round. So
Mhm.
I think telemedicine is probably going to be something that is going to become a new focus for providing medical care. I think a lot of providers were caught on their heels because we just don't do it. So I think you'll see that as something. I think Medicare might hopefully look at what is allowable. How should these things continue to be paid in the way that they're paying them now? And hopefully the answer is yes. I think that's
Today with COVID. Is that
yeah.
Yes.
Yeah, the fact that a patient can stay home and call, see the physician who's in his or her office, that's not typically allowable under Medicare. But why isn't it, right?
Exactly, especially when those people might be older or low income and have difficulty even with transportation simply.
Yeah,
Simply just
exactly.
getting
And
to the
have,
doctor is hard.
yeah, childcare issues. I mean, come on. So there's a lot that can be done. And I think technology is going to evolve too, where there will be more integration into our electronic health record system. So people can do real-time blood pressure, real-time temperature monitoring, those types of things. So well, I think we might see that.
Have you, so I know that there was, for a while, hospitals weren't allowed to do elective, I don't know if it's
Surgery?
surgeries or procedure. Did that affect you guys in any way?
No, we're critical access, and so the governor had we were covered under the waiver. I will tell you though, it made other people really mad. Other critical access hospitals who chose to stop doing electives of their own. I mean, for whatever reasons, they felt like we should stop too, and we couldn't. That is 50% of our revenue is elective surgical procedures, and we were already, we were already operating in the red, and we had no idea what was going to be happening from the federal government in terms of support with paycheck protection or HHS grants or any of those things. And I mean, for us, it did not make sense. We had already started taking stock of what our PPE was. Our purchasing director started looking at what was happening in China at the end of last year and started, making some strategic purchases with respect to surgical masks and things of that nature. We did a risk assessment every single day based on, current infections in the community. Did we have anybody in the hospital? I mean, we were looking at that. What was our PPE supply? What was the drug supply? We had pharmacy, they were part of the team as well. And we were able to continue to safely do it. We had a bunch of doctors from Steamboat who are on our medical staff, as well as the UC Health medical staff in Steamboat, and they're private practice. And so if they're not working, they're not getting paid. So they had to stop doing surgery in Steamboat, so they started doing more surgery here. And so our surgical volume stayed where it needed to stay. Every other bit of volume that we had, though, was really diminished.
Really?
Yeah. People just staying home. Our ER volume dropped way off. So that's the surgical piece really helped us.
So is Steamboat also in Moffat County?
No, Steamboat's in Routt County. They're 50 miles east of here. And
I know that there's a lot of people work in one and travel to the other. There's a lot of commuting back and forth between the two communities. What is their COVID situation? Do you know?
It's much worse. There's like 56 confirmed cases. I'd have to verify that, but it's 53 or 56 confirmed cases. They've had 4 deaths. They've all been related to the outbreak they had in one of their nursing homes, Casey's Pond, which has been horrible. I mean, to have that outbreak, I think, I believe, I don't know this to be 100% fact. I do believe a lot of the positive cases are associated with Casey's Pond, either employees or residents of that facility. And I mean, Steamboat is a resort community, so they've got, people traveling, all over. And I think they the other mountain communities were hit a lot harder. And they're still very tightened down, and they're definitely, I feel for our public health director, Carrie. She's the public health director for both Routt and Moffat County. And you could not have two more divergent counties, like seriously, politically, health wise, just we are night and day. And she's she's really, it's like schizophrenia for her, but
Yeah, take off one hat and put on another to do the same. Did you see, are you aware of any, it sounds like your hospital is pretty well, prepared that with the PPE purchases. Does that extend to the broader community there in Craig?
No, I don't know. I mean, we first of all, from the medical standpoint, we are most of the medical standpoint. I mean, we have most of the providers that are here work for us. The nursing home, I think, was a little bit more challenged in PPE, but they were able to access some supply through the Strategic National Stockpile deliveries that we would get. Our law enforcement had what they needed as well. Our community was great. We had a lot of people donating PPE to law enforcement and to the hospital, like construction workers and construction companies and hardware stores. So we've done okay. We have definitely not been in the dire straits that some facilities have been in.
What has been the most difficult adjustment for you in your work and home life due to COVID-19?
I think not.
Your family.
Well, it has affected our family. In fact, we just went through a death. My grandmother just died, and it was really pretty much the whole time this quarantine's been happening. And my mom and I were her primary caregivers, and so we really had to really limit who could come and be there at the end. And we had a service yesterday, but it was just like a few of us. My sister couldn't come from Cheyenne, and I mean, those are the things that are really hard. We had in the community a family lost an infant, and their church community felt. I mean, I think they feel very. It's very hard that they can't come together as a community to grieve, and that those are the things that have been really hard. Just being, I think it's the emotional connections that are hard. I miss that.
I think we all miss that.
Yeah.
Are there any activities that you have been delaying or deciding to put off, or any current events that you're not doing or your hospital's not doing?
Yeah, I mean, like for hospital week, which is next week, we typically do some big events around that with barbecues and various activities, and we're really scaling that back and not doing it. We are not doing, we're not sponsoring. So our community has, like I said, they've decided that they want these waivers, and they still want to hold some of these big community events, and we're not sponsoring them. We just feel like that sends the wrong message about that. I mean, we're not doing any of those. We put off our health fair is typically in April or May. It's typically in April. We had pushed it to May this year, but we canceled that because just couldn't have that event. We might look at doing that in the fall. We've really sort of put on hold planning any sort of fall events because we're anticipating potentially a second wave. So those are the things that we're not doing as an organization.
Can you talk a little bit more? I mean, I know you've mentioned it, and I kind of can assume that I understand what you mean, but about your fear about this reopening faster than maybe the rest of the state.
Mm-hmm. Yeah. Well, I feel like I guess just looking around and seeing, like today I had to go to the hardware store just here in Craig. My husband and I were the only ones wearing masks in the hardware store today. And I think like I said, our community has been compliant to a point, but now they're ready to just be like, it's done and we're going to go back to normal. And then add to that the fact that we're going to open, we're going to have far less restrictions than Routt County. Those Routt County people, there's a lot of them that will continue to be compliant, but I'm sure some that are like, hey, Craig's open, their restaurants are open, their shops are open, their retails are open, so let's go to Craig for the day. And come over here. Mesa County, like for you, Mesa County is open. So let's go mountain biking down in Mesa County because they're open for business. And I think it has the potential to create that spread. They're still experiencing positive cases in the state. So as those people travel to areas that are open, it's going to potentially cause that spread to come to these communities that have been basically isolated from it, where then it's going to cause, I think, kind of that rebound effect. So then we're going to have to close everything back down. We're going to have to ratchet everything back down. We could see an impact in our healthcare facilities that maybe we're not ready for. So that makes me concerned.
Yeah, I hear, like in Mesa County, I hear we've applied for this waiver, we've gotten this waiver, we're opening up this, and the other. And then I read the next story is the VA and someone else is putting up these tents in case of a medical surge.
Yeah.
What is happening? It does not seem like it's both ends of the spectrum should be going on at one time. It's scary.
California is case in point. They opened their beaches last week, and I think they were like, fingers crossed that it's going to go okay. And it was terrible. And now the governor's closing the beaches again. Like, okay, well, I told you guys. And I read our county's public health plan, and I read, the social distancing and wearing masks and on and on. And yet here I'm in the hardware store, and none of the employees had on masks. No one else except my husband and I had on masks. And I bet we saw 20 people in that store. So
frustrating.
Mm-hmm.
Yeah. What do you feel like how do you feel about the national response?
I think we've done well despite the national response. I think a lot of the governors, like Colorado's governor, I think Governor Polis really has done a good job. I mean, he was early on. He made really hard choices early on. He closed things early on. And I think that has helped Colorado stay, has not had the surge that New York had. I don't think I think it would have been a great opportunity to use like our Defense Production Act to put into production the, masks, PPE, making PPE. I don't think we have nearly enough testing availability. I don't think we should be opening things as quickly as we are until we have either better, point of care testing or, the instant testing or the serology for antibodies. We don't have that. I think that those are the challenges we still face nationally.
Know about testing in your community?
We're doing. Yeah. Oh yeah. We've done quite a bit of testing. We've done, we're getting ready to do our second community testing day on Friday.
What does that mean?
What we had been doing, we were only testing people in our medical clinics if they met the CDC's criteria for, close contact or these symptoms. And we were doing quite a bit of testing that way, but because we wanted to do some more community. What?
How long did it take to get the test results back?
Oh gosh. At the beginning, it was taking 4 to 6 days. And so it was really long, but now we're getting those tests back. Our courier leaves at 1:00. And so if they get on the 1:00 courier, we'll have them resulted within 24 hours of them leave. They're resulted within 24 hours of leaving the facility. So depending on when that person is swabbed, 24 to 48 hours, the turnaround has gotten much, much better. So, although we really had an interesting case, we had a woman come from a facility, and we suspected she might be positive or could be. We tested her and we got her test back. It was negative. And then she remained in the hospital, and the doctor wanted to do a surgical procedure, and the OR pushed back, and we said, we'll do another test. So the second test came back and she was negative. They got the test back the day of the procedure, negative. So they discharged the patient back to the facility, her home facility. They did a test, and 3 days after the surgery, that test came back positive. And we're like, what? So they bring her back to the hospital. We admitted to her to the COVID unit. We do another test that we sent to UC Health, and they have the immediate, they can do the test in an hour. That test comes back negative. So now we have 4 tests, 3 negative, 1 positive. So then we do another test 24 hours later. That test also was negative. So, but really a weird situation with that positive had to be a false positive, but that caused a lot of angst. So we've done a lot of testing, so we have community testing days. Last Friday, people could sign up if they had any COVID symptom in the last 14 days. So cough, fever, shortness of breath, loss of appetite, or fatigue. You could call and sign up for a time and you would be screened. And only 26 people called, and they were all negative. And so now we're doing another community testing day tomorrow for symptomatic first response, like essential employees. So but we only have a handful of people signed up for that. So we've been doing lots of testing. So we do have the tests available here.
That's awesome. That's amazing. I couldn't even imagine something like that in Mesa County. Happening. That would be just lovely.
Mm-hmm.
Is there anything else you want to talk about, or you want people to know or consider, or?
I don't know. I mean, this has been I do think the consideration is that we will not be returning to normal anytime soon. And I know everybody's ready to get back to normal. And I said that to my husband the other day. I miss our old life. I don't know what our old life was exactly, but I miss it. And I think it's just that freedom to move about. And, we wanted to go camping next weekend, just because we've been through a lot, and, everywhere is closed. I mean, and that's good. And it should stay closed, because it just should. And the rivers are closed, and people are kind of going stir crazy, and it's finding these new outlets it'll be interesting. But I don't know.
New outlets?
Yeah. I don't know what our new outlets are. We go for a lot of walks. We go for, some hikes, but that's pretty much it.
Yeah.
So.
Me too.
Yeah.
Started a little garden, and that's about it.
Oh, very good. Yeah. We're doing a little yard work around the house and doing some things. And so, yeah.
I want to thank you for your time.
Absolutely. Thank you.